Welcome to our coaching presentation on VA disability for back conditions. I'm Paul Bunn with Veterans Outreach Ministries. Today we'll focus on how the VA evaluates spinal disabilities, lumbar, thoracic, and cervical, and how we can help veterans clearly communicate the impact of their conditions during the VA process, and especially during their C&P exam. Spinal conditions are among the most common issues in veteran claims. We frequently see lumbar strains, degenerative disc disease, herniated discs, and radiculopathy. The VA ratings rely heavily on range of motion, evidence of pain, flare ups, and nerve involvement. Our coaching must focus on helping the veteran describe their limitations on their worst days, not just their average days. That's key. The VA uses 38 CFR section 4.71A to evaluate spine conditions. The rating is largely based on measurable range of motion, flexion, extension, and lateral bending. Pain during movement is compensable. Flare-ups that limit function must be discussed, and neurological symptoms like numbness or shooting pain down the legs are rated separately as radiculopathy. So when we coach a veteran, we ask about both motion and nerve issues. Here's how thoracolumbar spine ratings break down. 100% is for complete ankylosis, no motion of the entire spine. 50% if the thoracic and lumbar spine are fused in a non-functional position. 40% is given when forward flexion is 30 degrees or less. 20% applies to flexion between 30 and 60 degrees. And 10% is when it's between 60 and 85 degrees. You need to understand your limits and describe what daily tasks, like tying your shoes or sitting for long periods, become impossible during flare-ups. For the cervical spine, the rating system is similar, but uses slightly different thresholds. 40% for complete fusion, 30% for forward flexion, limited to 15 degrees, 20% for 15 to 30 degrees of flexion, 10% for flexion more than 30, but under 45 degrees, you need to ensure the provider understands ongoing neck stiffness, pain while turning, or headaches might indicate serious limitations. Sometimes it helps to see what the numbers mean. This visual shows what 30 degrees, 60 degrees, and normal motion look like. When you can't bend forward past your thighs without pain, that's significant. Use these visuals to help understand what you've been adapting to or ignoring for years. The IVDS, intervertebral disc syndrome, is rated differently. Instead of motion, the VA looks at incapacitating episodes. 60% is for 6 or more weeks in the past year, 40% for 4 to 6 weeks, 20% for 2 to 4 weeks, 10% for 1 to 2 weeks. Here's the catch. Those episodes must be documented and prescribed bed rest by a physician. Veterans often self-manage, so we encourage you to talk to providers and document your flare-ups thoroughly. When nerve roots are compressed, it causes radiculopathy, numbness, tingling, burning, or shooting pain. This can be rated separately for each affected limb. The severity can be mild, moderate, severe, or with muscle atrophy. Veterans might not realize this qualifies as additional rating, so you need to mention all symptoms clearly during the exam. According to 38 CFR section 4.59, pain itself is a form of functional loss. If a veteran has full motion but experiences pain during it, that still qualifies. Flare-ups matter too. We encourage veterans to describe those moments when they can't sit for more than 10 minutes, when they sleep on the floor or can't tie their boots. Those are the lived realities that justify higher ratings. This slide is critical. Bring imaging or medical records. Talk about your worst days, not your best. Explain how back pain affects sitting, standing, lifting, and mention nerve symptoms, even if you haven't been formally diagnosed yet. This is not the time to tough it out or minimize. The goal is honesty, describing the full real impact. Here are the direct references used by the VA when rating spinal conditions. General ratings under Section 4.71, AIVDS ratings neurological conditions under Section 4.124A, and painful motion under Section 4.59. These are shared with you so that you better understand what the examiner and rater are actually using. Knowledge builds confidence, and confidence changes outcomes.